Umongameli Cyril Ramaphosa ubhengeze ukupheliswa kokubekwa kweli phantsi kwemeko yentlekele ukuqala ezinzulwini zobusuku baphezolo. UMzantsi Afrika waabekwa phantsi kwemeko yentlekele ukuqala ngomhla wamashumi amabini anesithandathu kuMarch ka-2020 kancinane emva kokuqhambuka kwentsholongwane i-COVID-19. Umongameli uthi elinyathelo kukulibuyisela eli esiqhelweni.Oku kukwabonakaliswe kukwehla kwezinga losuleleko kuquka nokusweleka ngenxa ye-COVID-19.
We've now entered a new phase in the COVID-19 pandemic. The changing nature of the pandemic in our country was most evident in the fourth wave of the pandemic in December and January. Although we recorded a far higher number of infections in the fourth wave than in each of the previous waves, there were relatively fewer cases of severe illness, hospitalization, and death. During the third wave in July last year, the highest average daily number of COVID-related deaths recorded was 420. In the fourth wave, in February this year, the highest daily number of COVID-related deaths was 240. In the past week, this number has dropped to just 12. We are seeing a similar pattern in our health facilities. Of the 108,000 regular beds in our hospitals in the country, only 1,805 are currently occupied by COVID-19 patients. Of the 5,600 ICU beds in our country, only 175 are occupied by COVID-19 patients. This is part of a downward trend that is enabling us to return to normality in public health facilities.